You start watching the development of children even from the time they're born. Okay? They start babbling, they start pointing, they become active. Where a child with, we're talking about children with autism, they are unresponsive to things like that. You can see these things from as young as a year. And you really want to have families be aware of these things, because some parents have never parented, have never had a child before, so they really don't know what they're looking for. All children have developmental milestones, and you can start watching them from infancy. If you don't see those developmental milestones happening, then you should start questioning. And one of the things that you should really watch for is the baby babbling. Are they making sounds? Are they pointing? They should be pointing to different objects. Even when you're looking at a book, you know, you might be pointing to ball, and they might say "buh." You know, they start making those sounds. But children with special needs may not be doing these things, and that's when they should be thinking about being diagnosed. I was saying before that they should be, they could be diagnosed as early as 1 year old, and I truly believe that all children should be given that chance. And if they're diagnosed early, they can have intervention. They can have therapies that would really help them. Another thing that infants and all children with autism, they resist cuddling. They resist being held. So that's something that's an obvious thing also. As they grow older, and even as an infant, I guess you could tell, they seem not to hear you. So they don't even respond to their own name. They don't, if they're not babbling and if the parent doesn't get them treatment and they just go on and on as they age, they're not going to be saying words. They may have one word where they should be having 16 words. So you have to watch the developmental milestones. They can start to talk, but maybe not till they're 2 years old. Children, quote, normal children start talking way before 2. They have an unusual tone to their speech. They can't even hold a conversation. One of the main things that you also see is they don't use eye contact with you. So that's something that you can teach that, but if you're not a therapist and you don't know that this is happening, you can't help your child at that young age, where you really could if you are aware that they have autism. You can teach them to look at the person when you talk to them. They're not going to unless you teach them that. Okay? They're not even aware that they're not making contact. It's the person that wants the contact, those are the people that are aware of it. The child's not aware of it at all. Mm-hmm. So those are the things that you really should be watching for.
First and foremost, I would say go to your pediatrician, discuss whether or not your child is meeting the developmental milestones. If they're not meeting the developmental milestones, how the pediatrician can encourage you to, maybe they can give you some tips, maybe sometimes just some extra added changes that you're making in your home, making sure that you're talking directly at your child rather than yelling from one room to the other, or repeating words, using smaller sentences, 1 and 2 word sentences versus 5 and 6 word sentences. Maybe even just tweaking home environment, using less, having less toys out. Some of those little changes could just spark, can just spark the child's learning. So it doesn't always necessarily mean that you have to go down that road of being, tested and diagnosed. So definitely your pediatrician, I think that is first and foremost. If your child goes to an out-of-home child care provider, whether it's or an in-home versus whether it's a nanny or a child care center or a home environment, sit with your child care provider and discuss your concerns. What are the concerns in the classroom? Not that your child should be compared to another child in the classroom, but what are the milestones in the classroom? What are the other kids doing in the classroom? What is their peer relationships with the other kids in the classroom? And then after that, if you don't see a change, go with, your mother's intuition that, if deep down inside that you really feel like something's wrong, go for it. It's most important is to get the services that you need at the youngest age possible. That is the best chance for your child to be mainstreamed into, regular society.
If you enjoyed this information and would like to receive more free videos where I answer questions people ask about daycare, visit daycarepennington.com.